Dr. Noel Concepcion in the studio with us this morning from the Guam Regional Medical Center. Welcome home.
Thank you.
How you doing?
I'm great.
How's your heart?
It's okay.
Good. You ever check yourself, by the way?
Yeah, before I came here, I made sure I had a stress test.
Yeah, I know this is kind of foreign territory. We don't usually get to talk to you. The last time I think it was several years ago.
Yeah.
When we actually did it from your place in Modesto, California.
Yeah.
But now you're here. Wow.
Right.
Huh? What a big step.
Yes.
In this part of your life, who thought that you would switch horses like that as you did coming to Guam?
Yeah, no, it's a big move. It's
Yeah.
a big move, but my wife supported it, and we talked about it, and the new hospital was being built. Talked to some friends, and so I thought it was the right time.
Yeah, it took you some time to get to this point. I mean, for years people have said, we need our local people to come back home. You were educated here. You've grown up here. All of your friends and families are here, B's family. Had this been the first time that you'd ever seriously considered doing this? And was it because GRMC said, if we build it, he'll come?
Yes. I mean, obviously, there are significant challenges to starting or having an ongoing heart surgery program. Mm-hmm. We showed over the past decade that it can be done on an intermittent basis at GMH, but maintaining it was difficult from both sides. It was also a major commitment from the physician side.
Yeah,
it takes a team to do heart surgery, and putting a team together is challenging. And then, of course, the cost to equipment, supplies.
It just wasn't a fit for GMH in the status of their finances and the status of their their existence. It's just wasn't a fit.
Yes, and to be fair, there are more fundamental issues that are just as important as heart surgery. Primary care, preventive care. Those are the things that should. If you don't have enough money for everything, there should be a priority basis on where you spend your money.
Yeah. And
I think that you got to start out with supporting your basic services first, which is fine.
Yeah. I mean, it would have been great to have such a specialty at Guam's only public hospital, but I think that people from a mile away could see that GMH couldn't support some of its own basic services to provide that level of care and consistently, because you were sort of sweeping in and performing these procedures, and then you were leaving to go back to your other practice. So What was the continuity? I mean, there must not have been much of it, right, afterwards?
Yeah, well, there was a little bit. I mean, we over numerous trips, we established a sort of certain protocols. GMH actually had some pretty good systems in place. I had a nurse there that functioned, that would see the patients in the clinic after I left, and probably for about a month, and so I at least had some follow-up. And then when we did our subsequent trips, then we would see the patients in the clinic as follow-up. But admittedly, it's not the same as the practice that I had in California, because I wasn't around as much. Fortunately, most people did well, didn't have any major issues after we left, but it was always definitely an area of concern for me, is what if a complication happened after I left, but like I said, fortunately, it never did.
Yeah.
But I think it was just, the diligence.
Well, because you did such a good job.
Well,
one would like to think.
We did a good job, and like I said, I had help at GMH in following the patients, and if there was some problem with the incisions, that we could start antibiotics. But I mean, carefully selected patients, it can be done.
You've had a successful practice in Modesto for many, many years, and your own clinic, your own gig, you called the shots.
Yeah.
What was the big attraction to coming back to Guam, where we haven't had this capability, and it was going to be built based on your expertise and I guess your call.
Well, yeah, good question. I think it was, just I'm in that phase of my career where I wanted to do something different. I was quite, I was happy with my practice in Modesto, but I've been doing it for 26 or 28 years, so.
Is this sort of a slowing down for you from that pace that you're saying?
In a sense, in terms of volume of cases, but in terms of mental anguish, it may not. It's also had its own challenges,
I was just listening to CBS News. They had a study about how doctors have some of the highest anxiety or depression levels. Is that true? Like, is it?
Well, yeah.
It comes a little bit with the territory.
I mean, it's. I think just people are just being more honest, and I was just reading an article that burnout in physicians. Or close to 50%, but it's interesting the specialties. It's happening in specialties where you wouldn't expect that to be, like internal medicine, physical rehab medicine. Some of the basic primary care is where that's happening, and rather than the subspecialties.
Well, you said the volume of patients. You had a large, I'm assuming a higher volume of patients in your Modesto clinic.
Right.
But we now, you're coming to a population of people where heart disease is up there on the scale of diseases that people die from on Guam.
Yes.
And people, they fly out of here, pretty much on the weekly to go and seek that kind of care. So the volume of cases, is that necessarily going to be diminished because you moved here?
No. I think eventually, the volume could be here. I mean, just from what I've heard and seen, and could easily be over 100 cases a year.
Yeah.
But I think that eventually a second surgeon is going to be needed. This can't be this can't be a one-man
show.
Yeah.
But you also got a good backup team. I mean, Dr. Holland is there as well. She's part of the specialty team, right?
Yeah, and Dr. Shaker.
Dr. Shaker.
So there have been excellent additions to the department. But building a team takes time, a little bit of time.
Is there something satisfying? I don't want to get too personal into the emotional side of it, but is there something satisfying in this point in your career, to coming home and building a team from nothing, or building something that Guam has not ever had? I mean, you would be a pioneer in that way.
Yeah,
hate to put the pressure on you.
No, that's what my wife calls it.
Oh,
go and be a pioneer.
Yeah.
And that's probably an appropriate analogy to what it is, because the path is not there.
Yeah.
And I think you identify the problems, or you run into a hurdle and say, what am I going to do? First you feel you get a little discouraged. But then you say, well, what did you expect?
Yeah.
Then you figure out a way to overcome that hurdle. And the one thing about Guam is because people, sometimes other people outside of the medical field may come up with a solution. Mm-hmm. To a problem. So I think there is no blueprint, there is no book on how to do this.
Well, that's exactly it. You're going to be blazing a trail, but how much different is it to be blazing a trail in an uncharted territory? No pun intended, but uncharted territory based in comparison to established policies in California.
Yeah. Yes, I mean, I left the program that was very mature, and but again, I do think that the opening of GRMC and all the effort and time that that it required. I think that was a significant step in the development of healthcare on Guam. And then with the eventual decision that they wanted to start a heart program, and I think Dr. Mike Cruz was a big supporter of that. It was also another step. So all these things are just part of the natural progression of things, and it's having kind of been witness to all this over the past 10 years. It's I still find it amazing that this hospital was completed and built, because I know there's a lot of challenges to it. I mean, we went through all this with the old medical center in Marianas, and I wasn't there for it. I just only hear now in retrospect what happened, but I mean, it failed after 1 year due to financial reasons. So I'm sure there were other reasons. So it takes a lot to build a hospital and then maintain it. So.
Well, and that's why the news of them bringing such a top gun in your field to Guam seemed like a whole lot of overkill. And I mean this in a nice way, but it seemed like realistically an overkill, for a market that is established, but we don't necessarily have any tried and true, facility to meet maybe all of the demands that you might require to do this successfully.
Yes, that's part of the challenge.
Yeah.
I have an idea. I have a very good idea how the program should look and what it requires, part of the job is to convince administration that this is where we need to go, and then if we agree on that, then I think we'll be okay.
Is that still sort of an if to a permanent decision to stay, or is a permanent decision already been made?
I mean, obviously, if I can't do what I am supposed to do, then that's a part of the equation. Part of the reason I came here. I mean, on the other hand, I did leave some family behind, my kids and my grandchild in California.
Yeah.
So, I mean, I'm happy to be back on Guam. It's been, the weather's been great. People are nice.
Oh yeah,
and
you could
reminded,
be cold right now. Yeah.
And you're reminded that Guam is a nice place to live.
Yeah. The point was made about the announcement that there were 3 surgeries that that were done. Four open heart surgeries that were performed up at GRMC. Why announce after 4 and not announce after 3 or not at the next 4?
Well, because the usual is to announce even before the first one that you're planning on doing it. I think in the past that's what's happened, and that's okay. But I asked the people at the hospital to wait until we finished this round. We were planning on doing 4. I wanted to make sure that everyone did well, and so far so good. 3 out of the 4 have gone home. 1 will probably go home tomorrow.
Oh.
So it's.
You wanted to have a nice successful race.
Yeah, and I think it's more. It says more to say you did 4 instead of 1.
Well, this is true.
Yeah, and even after the. If you make an announcement the day of the surgery, the patient, you still don't know how well the patient's going to do. So I guess it's just being cautious and being a little superstitious also. Well,
do you feel the pressure of great expectation? The pressure that like they brought this, this great guy, this, stellar in his career and has an incredible record. I know I'm just praising you a lot, but
you're embarrassing me.
But it is what it is. I mean, it is. This is stuff I'm making up. You have had a stellar career, and it's been very successful. Do you feel that there are maybe an exaggerated expectation of what you'll do here? Do you think that, or do you feel any pressure to perform at a standard that might be exceeding what you plan to do?
Well, if I feel any pressure, most of it probably comes within myself. My feeling is that the standards that we should aim for on Guam should be the same as, the standards that would be in the States. I think people should feel like if they have their surgery at GRMC, that it's safe for them and that they'll get good results, which means they should leave the hospital alive. Now, obviously, there's going to be patients that are very sick, and you may have to do them as emergencies, and you're just trying to save their life, that will have problems and not make it.
Yeah.
But as best as I can, I would like to try to be selective, especially in the beginning, because that's right. I mean, there's a certain amount of confidence that people have to have. It was the same thing that when we started at GMH. I mean, obviously, in the beginning, people that had agreed to have their surgery there were people with no insurance or poor insurance. But after we had a little bit of a track record of maybe 20, 25 patients, and people with insurance started asking to be done there. So, and people have a right to expect that, many people have choices. Not everybody, there's a certain group that can't leave the island and they don't have a choice, but many people do. So, for them, their expectations should be met that they can recover at home, but at the same time, they're going to have a surgery that will be safe and durable.
You're coming back, to a population, a culture of people that's not unfamiliar to you as some of our eating habits, some of our history of food and things that we grew up on. There is a lot of heart disease on Guam, diabetes. I mean, and it's all sourced back to that one thing, is our diet. Do you feel like there might be a sort of reinvention of the wheel that needs to be done as far as education about these things? Because we haven't really necessarily had a specialist, regularly that is accessible to us without having to go off on island. And there's I think there's a certain understanding of the culture.
Well, I think going back to what I said about priorities in healthcare, I mean, there's no question that primary care and the control of risk factors is important, and that's what the primary care physicians are doing on a daily basis. By the time they get to me, it's kind of too late in the sense that the risk factors, the disease is already developed, and part of it is genetics, unfortunately, and that may there's only so much you can do about the parents that you had, but certainly genetics in addition to lifestyle makes things worse. But I've seen changes. These people seem to be more active here, and like I tell people, brown rice is more of an option here than it is in the States. So
yeah,
that says something.
Oh, that's good to know. Well,
that says something.
Yeah. Well, so did you bring the whole brood with you? Like you said, you have a few. How many kids do you have altogether?
I have 3 sons.
You have 3 sons, and they're all still in California. So nobody's wanting to make that big move. Is BB Gun here with you as well?
Not yet. She was here for 2 weeks, and then she went back, and so she'll hopefully be back permanently in January.
Okay, and so this is this is a permanent sort of a semi-permanent, but reasonable commitment that you are making. Yeah. So that we can expect you to be here for several years. It's a big transition, though. Although you grew up here, it's a big transition, right?
Yeah, it is.
Yeah. Did you drive by the old digs down in Jonestown? That was our hangout when we were in high school.
No, I haven't done that.
There are like haunting memories every time I drive by your house over there. How's your sister Emma, by the way? Where is she?
Oh, she's in Seattle.
Oh wow! Okay.
Or near there. She's she's also all her kids are grown. And,
yeah. That's all our kids are grown. I mean, that's
right.
Yeah,
that's right.
We're all sort of in that area now, being grandparents, and the round two. Well, I know that there was great promise, that GRMC had when they talked about you coming, and it sounded like they were not going to spare any expense to accommodate your needs, and they put together, assembled. I mean, Marion Allen's a great gal too. They assembled a good team as backup, and so you think that one more cardiothoracic surgeon might be a great part of the deal?
Well, eventually. I mean, in my interview just before this, it would, that question was raised, and I think eventually with the population, one person can't do it all. I mean, there's vacation and other things.
Yeah. You don't want to be put out to pasture yet, though, do you? Because you're still, what, 25 years in? You still got another 10 going for you.
Yeah.
Well, I'm pretty sure that everybody will expect and receive whatever expectations that they've had. I hope I never see you in that capacity, but you're more than welcome to come here and be on that side of the mic.
Well, one thing also I'd just like to add is that I think that philosophically GRMC, there are two hospitals, there are three: Naval Hospital, GRMC, and Guam Memorial Hospitals, and I think that there's room for both hospitals to coexist.
I think that was that's kind of the order that people have been talking about, the line.
And anyway.
Yeah, fantastic. Dr. Noel Concepcion, welcome back home.
Yeah. Can I one more comment?
Sure,
just real quick. I want to just thank Governor Calvo, because he did assist us in his own way by lending assistance from GMH with a few things. So I think that was one of we had some issues that needed resolving, and one of it was getting a little bit of help from GMH, and so he helped grease the wheels.
That's fantastic.
Okay?
And that's good to know. Dr. Concepcion, thank you so much for joining us.